We're coming up to the end of National Public Health Week. Today's day 6, and we're finally talking about books. I wanted to talk about books I've read over the years that have really shaped my understanding of public health and healthcare in the US in general. Some are more academic and give history, or they tell a story, and others give concrete steps for how to make a difference in public health and healthcare. If you don't know me, hi, I'm Nadia. I talk about public health and pop culture, and let's just get right into it. The first book I want to talk about is Medical Apartheid by Harriet Washington. I read this during an internship multiple years ago, and it was really helpful for understanding the sort of history behind how Black people have been treated in medicine and how they've been used for experimentation without gaining any of the benefit from medical advancements. It talked about things ranging from experimentation to how Black people were required to submit to research trials in order to pay for care, to things like public dissections and even grave robbing. The main story I remember from this book was one where white medical students were pranking each other by putting corpses of Black people in each other's beds. And I just remembered how gruesome that was and how honestly wild it was that that was even allowed and people saw that as funny. It also talks about how Black people were excluded from opportunities to participate in medical training, and it also mentioned how a lot of Black medical schools were shut down in the 1900s, which I will talk about more in a later video. It also comes up in another one of the books that I'll talk about in this video. The next book I want to talk about is Political Determinants of Health. This book basically argues that voting, government, and policy are all determinants of health in addition to the traditional social determinants of health. It talks about history going back to the Revolutionary era all the way to the present day with the Affordable Care Act. And it also talks about how advocates have pushed for health equity throughout the years. I think the language in this is pretty accessible for it being an academic book, and I think you can definitely get through it pretty quickly. The next book on the list is The Collective Cure. This book actually just came out this year. It follows the perspective of the author and some other women as they interact with their communities, and the main purpose is to show the importance of the social determinants of health and having social ties. It talks about the author's experience growing up in Medco, which was the integration program in Boston, and her experience with multiracial children, being in a multiracial marriage, and then also the differential treatment her family members of different races got. And then it also talks about experiences from New York City to Alabama during the pandemic and how people stepped up for their communities in that time. There's one scene where a college student walks in and finds her uncle dead during the pandemic, and I just thought that was really gut-wrenching. And it was followed up by this story about how his community came together, all these people that his niece didn't even know, to help pay for his funeral arrangements. It also talks about things from emergency preparedness to education to housing and how they're all important in shaping community health. It also talks about things like the importance of community-based participatory research, which is when communities are involved in designing research studies. I think you'll really like The Collective Cure if you like following specific people in a story. Next on my list is All Health Politics is Local, which essentially focuses on the idea that it's not enough to focus on national policy or state policy. You have to focus on individual communities when you're making public health changes and doing advocacy. And it focuses on public health efforts in New York, LA, Appalachia, and in Cleveland, Ohio. Next up is The Long Fixed. I read this in undergrad, and if you liked my episode of Public Health Dispatch where I talked about the problems of the US healthcare system, I think you'll enjoy this book. It kind of talks about similar things and also gives solutions based on whatever role you have in healthcare, whether you're a provider or someone else. Next on the list is Generic. This is sort of about the history and policy around prescription drugs, particularly around the availability of generic medicines, which, if you don't know, there are brand name drugs and then there are generics, which are meant to be chemically the same as the brand name drug, but they may be manufactured somewhat differently. And the purpose of having generic drugs is to make drugs more affordable. And so it just kind of goes into both the history and the policy changes over time that have contributed to the current prescription drug landscape. Along the same vein as Generic, we have Bottle of Lies, which this is more of a investigative journalism book. It also follows characters if you're into that sort of reading, and is sort of talking about this investigation into improper manufacturing practices in medication facilities, and it also talks about some of the shortfalls of the FDA in sort of regulating those facilities. Next is Deep Medicine, and this focuses on how AI can be used to help diagnose conditions, but it also emphasizes how a doctor's input is still needed, because even though AI is trained on research, everybody still needs personalized care, essentially. And the author really focuses on how we can better harness the research and AI tools, and then also doctors' judgment to improve patient care. And then it also talks a lot about the ethics of AI, since the sort of rapid growth of AI has led to a lot of people not really trusting it, understandably. And so I think this is a good read, even if you're not necessarily a huge AI fan. And last but not least, we have Massively Better Healthcare, which is also a new release. And this talks about healthcare from the perspective of entrepreneurs, which is different from my usual perspective. And I ended up picking it up because it feels like everyone is trying to be an entrepreneur lately. So many people I went to undergrad and grad school with have started businesses. And so this was a really interesting read. And even then, I think some of the lessons for like starting a healthcare business can apply to public health advocacy as well, because it talks about like making sure you get people enrolled in whatever business program you're designing, which relates to making sure people participate in your public health campaign. And then it also combines some of the other lessons from other books about like drug policy, the Affordable Care Act, healthcare policy, healthcare history, things like that. So I think this was a really great read for that. That is all I have for today's video. Let me know in the comments if you find any of these books interesting or if you've read any of these. And I will see you all tomorrow to talk about public health programs.